Good. Thank you for making it tonight. Tonight's different. It's called Open Forum. I've never done a health talk like this before. But after the health talk, there's multiple people that come up and ask different questions about a variety of subjects. So it was suggested we do an open forum. What I want to do is present an idea. Now, this is going to be unique. See, in a moment, everyone's going to have a chance to answer questions or ask questions, and I'm going to repeat the questions because it's going to be on YouTube. But I want to present a different idea. If an alien came down and gave you a book, and the book detailed out how you didn't have to live within the rules of gravity, okay, that you could now think yourself to fly, that you could float, that the laws of gravity didn't apply to you, would that be of value?
Sure. Oh, yeah.
Kind of, but think about this. It's a difficult concept, but it's something that we're trained, ingrained, and this is something that we're probably going to progress and learn, that gravity laws can be changed. And we know the laws of physics can be changed. What I want to do tonight, to start off an open forum, is to have you present an idea that disease doesn't really exist. Blood pressure, high blood pressure doesn't exist. It's just the body adapting. Cancer doesn't exist. It's the body protecting yourself from deficiency or toxicity. So what we got to do is look where change happens. Change doesn't happen in just saying the same thing or understanding it. Start to open up, and this is going to be different concepts. I'm giving you a book that says gravity doesn't matter. Okay? Good. Who would like the first question? Anybody have any ideas? Okay, any questions? Yes, ma'am.
What do you think about bioidentical hormone replacement therapy?
Oh, what do I think about bioidentical hormone replacement therapy? Plant-based is very good, but it'd be better to find the problem. Okay, in most people do bioidentical hormone replacement for when you're going through menopause. Now, the main problem that we have in this country is not that, well, menopause really isn't a challenge in most of the other countries, because progesterone, which is one of the most wonderful substances on the planet, is found in the cheapest food sources. So we also, and we're living in this country in a sea of estrogen, because most pesticides are estrogen-based. So an excess of estrogen from the pesticides, from the commercially produced animal products, from the commercially produced packaged products, are going to cause estrogen excesses, which is going to cause a need for bioidentical hormones. Also, in this country, it's very, very common with those excesses of estrogens to have problems with the ovaries, problems with the uterus, excessive bleeding, periods that don't stop. So in this country, instead of looking for the problem, is they'll do hysterectomies. And when they've ripped out the ovaries and uterus, not like, let's say you were identified with an obscure gene and they think that you might develop some type of cancer someday further on down the road, they're not going to teach you how to suppress that gene. They're not going to tell you that your immune system is involved in gene expression. They're just going to have you rip out your ovaries and uterus, such as a lot of famous people are doing today. Okay, so if you've had your ovaries or uterus removed, bioidentical hormones are going to be one of the best. That's one of the plant-based ones. So that's going to be ideal. But it'd be better to switch to an organic, hormone-free lifestyle and have your system work better. Okay, does that make sense? Next question. Yes, ma'am.
How can I tell if I'm deficient in one or more nutrients, and how can I tell which ones they are?
How can I tell if I'm deficient in one or more nutrients and which nutrients they are? That was a good question. That's what got me excited about this. I know, it's a brilliant idea. Figure just living in this world, okay, you're going to be mineral deficient. Okay, that's universal. Now, you can live, you can utilize minerals without vitamins. You cannot utilize vitamins without minerals. So knowing that our soil's depleted, everybody in here is going to be mineral deficient. Except for me, my sister, and who's ever taken a liquid mineral replacement. Oh, there's about 3 or 4 more people in here. So the minerals, you're going to be mineral deficient guaranteed. And the minerals have to be whole food. They have to be grown in nutrient-rich soil, which means the plant is literally going to ionize the minerals. See, most like iron supplements is actually iron ore. Most calcium is just ground up bone. Most potassium is just chemicals. Okay, what ionized minerals are is a plant draws it out of nutrient-rich soil, converts it so it's more bioavailable. So it has to be whole food plant source vitamins, and that's why we recommend Body Balance, which is based in sea vegetables grown in the Arctic region. So it's getting the minerals from, just millions of years, where the glaciers have been cutting the minerals and getting nutrient-rich soil. So sea vegetables are one of the few plants left grown in mineral-rich soil. So everybody's deficient in minerals. Once you get that solved, you want to get most of your vitamins through food sources. And this is going to be whole foods, organic foods, as best as you can. Then knowing that you're going to have certain stressors. Okay, you're going to be omega-3 deficient, and that's everybody in America, because our diet is omega-3 deficient. Omega-3 to 6 ratio should be 1 to 1. And since diseases started about 7 to 8 to 1, and the standard American diet is like 20 to 1, okay, that means that you're omega-3 deficient, more than likely. So supplementing with a mineral supplement, supplementing with omega-3s is going to be ideal. Now the omega-3 source, I really like the algae-based, the plant-based ones. Those are the best. Because it's more bioavailable and you end up with less toxins. They've got some animal-based ones, or fish oil-based, which are very, very good, except you got to check the source. It's got to be small fish. They got to be harvested in northern waters. It's got to be cold. They got to be microfiltered. And now that we're getting more radiation hitting the ocean from Fukushima, and we're going to have more nuclear things going off in the future too. So the animal sources are going to be less and less and less safe. Algae-based are going to be the best. Then, depending on your latitude, distance away from the equator, the less sunlight you're going to receive. So you have to have vitamin D. Luckily in Europe, they're doing a lot of sun booths, which are rich in UVB radiation. So they're supplementing, this is a vitamin. You stand in a UVB radiation booth and you get sunlight. So sunlight is going to be vital, except at our space away from the equator. From October to March, we don't get enough solar radiation. So in that space of time, you need to supplement with vitamin D3, that's dog 3, 3,000 units for every 100 pounds of body weight on average. Now, if you have excess stress, like let's say you're a chiropractor seeing, say, 700-800 people a week, you might want to supplement with more vitamin D3 and more omega-3s, because you're going to want to occasionally shoot a doctor that's giving your patient bad advice, and that's illegal in months with ours. So you can't do that, so you have to stimulate the parasympathetic or that calming influence so you don't go in there and defend your patients. Okay, so excess omega-3s. Then all the other little ones, like the vitamin E's, the vitamin A's, all of those would be ideal if you got them just from straight nutrients. This is why a lot of the supplements that we recommend, or the nutritional supplements, they're going to have raw cacao in there, which is super loaded with minerals. We're going to have maca root. We're going to have mesquite powder. We're going to have super plant-based proteins. And those are all going to have virtually all the minerals and vitamins and nutrients that you're going to need. Okay, so you are going to need those no matter what. Depending on the activity level, you're going to need more. But just being regular humans, that's it. And if you're recovering from a certain disease or you have certain disease processes, you're going to have specific, more like antioxidants perhaps. Like let's say you're recovering from kidney disease, you're going to need more soluble fibers. Let's say you're recovering from a thyroid disorder, you're going to need to clean the gut, because the gut is where 20% of T4, which is a thyroid hormone, is converted to T3. So a lot of these disorders that the doctors have labeled you, whether it's a thyroid disorder, really isn't a thyroid disorder. It could be from stressed out adrenal glands, it could be from the liver. So look deeper for the cause. But that's generally what all everyone's going to be deficient in. Does that make sense?
Thank you.
And then depending on the disease, you may require different, more extensive supplementation. Okay, next question.
So you said mineral deficient.
Yes.
How about a multivitamin?
Good. Mineral deficient. The question was asked, what about a multivitamin? I've never seen a good multivitamin.
Really?
I've never seen a good one. Okay, I mean, there may be some out there that are whole food, plant-based, organic, that don't have a lot of synthetic binders, that have living enzymes in them that weren't baked into a pill form. Okay, because that's one of the main things. If they're a capsule, they may still have living enzymes. If they're baked into a tablet, they typically have a lot of the nutrients baked out of them. So I'm not a big fan of those. If you can get them in whole food sources, there's a lot more things inside of whole food than what we know about. I mean, over 10,000 bioactive enzymes in a tomato. It's just whole food is a lot better for you. And the multivitamins, get it from a variety of food sources. It's much better. Now, what if you're not digesting the food that well? That's an excellent one, because you got to figure, if you're in that fight or flight state, if you're in a stress state, your body's going to be in that sympathetic dominant pattern where blood supply to the gut's going to shut down. Or let's say that you have had antibiotics in the past. That's going to cause a leaky gut. Or let's say you're under extreme stress. That's going to cause change in motility or change in movement of the nutrients through that stomach or intestinal lining. Or let's say that you were confused and didn't understand physiology and got a flu shot. Okay? Or you were completely ignorant and you decided to get a tetanus booster because you believe the lies on the CDC website that it's a vaccine-preventable disease. So let's say that you got sucked into that dark vortex nightmare. All of those are going to cause leaky gut. Well, that's going to cause malabsorption. So this is when you got to heal the gut first. So again, like when you go back to any nutrient deficiencies, look at the entire system as being tied in. So if the entire system's tied in, you got to heal the gut first. Okay, and that's usually what we recommend is, for sure, don't drink any water 20 minutes before a meal, no water during a meal, or no water 20 minutes after a meal. Okay, and you might say, why? Because you got a nose over your mouth. So when you smell this beautiful plastic channel changer, when you smell this beautiful zucchini, imagine it's a zucchini, okay, and you go to eat it, as soon as you smell it, your stomach produces a certain type of acid. And when you go to bite it, so really your eyes is where digestion begins. This is what you're going to eat. Then the smell stimulates that frontal lobe to produce the acid, stomach acid. And then when you chew it, this is where carbohydrate digestion begins, and protein digestion begins in the stomach, and fat digestion begins in the duodenum. So if those three areas are working correctly, you're not going to have a problem. If those three areas have been damaged by neurotoxins or toxic food components, or let's say you're older and you've had permanent damage to damage the enzymes, you may have to supplement with specific enzymes to help with that digestion. Or you may have to pre-digest the food, which means blending or juicing, which also pre-digests it. And if you've had really bad gut issues, you may have to pre-digest doing blending or juicing and do the additional enzymes for a period of time while the intestinal tract heals. Okay?
How about the kidney stones?
Oh, kidney stones. Okay, so now, what about kidney stone formation? How to solve those? Okay, so what happens with kidney stones, and this is craziness, because I was listening to this, I mean, it's kind of like military intelligence, but this is not a really sharp doctor. He said the only people that he recommends to drink, 50% of their body weight in water a day are people who have had formed kidney stones. Nobody else should drink that much water. And I'm thinking, well, that's kind of stupid, because if you drank that much water to begin with, you wouldn't be forming the kidney stones. So kidney stones are not from excess calcium. It's from dehydration. If you look at the kidneys are about the size of your fist, and you've got two of them. Every 20 minutes, they filter 6 quarts of blood. So the health of your blood is going to give you healthy kidneys. That's fact. If you have toxic blood where you're taking in toxic food components, or it's dehydration, or the blood's not healthy, some of those minerals, some of those things that it's filtering out, that it's trying to get rid of, may bind together. And if they bind together over a long period of time, they may form stones. Now, the stones, there's a couple of processes to eliminate kidney stones. One of them is to drink organic apple juice. Okay, and we're talking about a gallon a day for about 3-4 days. And what that does, the malic acid in there will actually decrease it. There's also some enzymes and some, nutritional websites. The apple juices work pretty well for a lot of patients that I've had. And it's a gallon of unfiltered apple juice. And you got it, if you're juicing it yourself, juice the seeds with it, because the seeds have a little bit of arsenic in there that actually starts to break down the stones themselves. So it's fantastic. And once you have a healthy lifestyle, the stones can be eliminated. If you have stones that are too big, that are causing too much discomfort, the ultrasounding is probably the least invasive, where they actually go in and blast it with high-frequency ultrasounds to break it up. However, that is going to damage some of the kidney and some of the structures. So that's like a last resort of a bad lifestyle. Okay, so it'd be better if you had a healthier lifestyle and have healthy blood. Okay, then you're never going to get kidney stone formation. If you have protein deficiency, like let's say you're eating a lot of soy products, the blood vessels aren't going to be free and holding oxygen. They're going to be clumped together in what's called rouleau coin formation, which they're clumped together. That means not only not going to hold a lot of oxygen, but if you get those things flowing through the kidneys, you're not going to have healthy kidney flow, and that's also going to cause more minerals built up. So it's going to be poor diet, poor nutrition, excessive toxicities, because that's what the kidney is. It's a filter. Are going to start to form those stones. Okay.
And you would know you had it if you had a kidney stone.
Kind of. Kidney stones. If you're you would know you had it if you had. What are the symptoms of a kidney stone? It's going to hurt. But what's interesting, a good way to differentiate this is the difference between a pinched nerve, which can simulate that, or a kidney stone. A kidney stone is not going to increase or decrease in pain on position of motion. So I'll get patients in there that say, gosh, doc, this pain's been bugging me for like 3-4 days. It's just killing me. It's right here. It's got to be the kidney. It's got to be the kidney. And I'll say, okay, well, bend off to the other side. Oh, God, that feels better. I can confidently say, hey, it's not the kidney. Because what you're doing is you're opening up the vertebrae on that side, so if it's a pinched nerve, it's not going to change. A kidney stone's going to hurt here, hurt here, hurt here, hurt here, hurt here, hurt here, hurt here. And I'll say, guess what? You got a kidney stone. Okay, so what we're going to try, we're going to take pressure off of the system. We're going to put you on a whole bunch of apple juice over the next few days. You're going to have diarrhea in about a day. Okay, and that should decrease the symptoms almost immediately. Plus, two, what we're going to do, we're going to adjust the area or the nerves that supply the kidney, and that tends to take care of a lot of the symptoms as well.
We've heard lemon juice.
We've heard lemon juice is good, was the question, for kidney stones. There's a couple of things with, I haven't heard of lemon juice with kidney stones, but there's a lot of different therapies out there that I'm not aware of. One of the things with lemon juice is lemon juice and grapefruit juice are known for a good liver flush. The dangers of liver flushes, though, and this is one of the things that you have to be extremely cautious of, is the liver is a giant enzyme factory. In fact, anything you put in your mouth gets filtered through the intestine, has to go through the liver. So this means the aspirin, the Tylenol, the muscle relaxant, the broccoli, the carrots, the chicken, the burger, the fish, the everything has to be filtered through that enzyme factory, the liver. So the liver can build up toxicity. So a liver cleanse, a gallbladder flush, those things are very, very, very important to do throughout life. However, when that liver contracts and secretes those poisons, it secretes it through this duct called the common bile duct. And this is, anybody that's had gallbladder issues is going to have a major liver toxicity issue. And the gallbladder is actually designed to store and concentrate bile. And what bile is a superfiltrate of blood. And so then you start looking at this, say, wait a second. If we're going to talk about liver flushes, we have to talk about gallbladder, right? Yes or yes? If we talk about gallbladder function, we got to talk about spleen function. Why? And then we got to talk the health of blood. See, this is why our society is so sick, because it's segmented into different professions that are not only are they not talking to people about the holistic nature of the human body, it's foolishness, because you got to figure the liver, everything that you eat goes through the liver. The liver's function, it's like an enzyme factory to break those nutrients down into usable proteins, fats, and carbohydrates. And now there's a spleen over here that filters out blood, and it's also involved in the immune system. Now, red blood cells only last every 120 days. The red blood cells in the spleen checks each one. Anytime it finds one that's not viable, it takes that red blood cell and passes it off over to the liver so that the blood proteins can be reutilized. So it takes those old blood proteins and it forms bile out of it, bile salts. And those bile salts are stored and concentrated into this little tiny sac. It's like a little balloon. And so as soon as, when you eat fats, as soon as that fat passes through the stomach and hits this area just beyond the stomach called the duodenum, instantly the sensors inside of that duodenum cause the gallbladder to secrete. Okay, and then it secretes that bile into the duodenum, and that starts breaking up the fats. The problem is, and this is a huge problem, is that both the common bile duct, that gallbladder drains through this bile duct, drains through the same place that the pancreas drains. So you can actually get gallstones that block that duct and can cause pancreatitis or inflammation of the pancreas. So that can be a whole host of problems. So in order to have a healthy liver, you've got to watch what you're putting in your system. Okay, in order to have a healthy gallbladder function, you've got to watch the healthy blood. Which makes sense, because if you're eating healthy food, you're going to have healthy blood, you're going to have healthy liver function, you're going to have normal function. And they used to say that there were 4 F's for gallbladder dysfunction: over 40, female, fertile, and full-figured. Okay, don't smile. Okay, we have a doctor in there, and this is one of the mnemonics that I would teach to remember. It wasn't full-figured. Okay, but now what happens is, when you're talking over 40, so probably not a healthy lifestyle. If they're full-figured, they probably don't really not eating correctly, so that means their blood is toxic. If they're fertile, that means they've had a couple of pregnancies, which means that a child is like a parasite. It sucks the nutrients out of their system. So if they're not supplementing with healthy nutrients during that pregnancy, their body's going to be nutrient deficient. So they went through a period of time where they're nutrient deficient. Okay, and then being female, you're talking excess estrogens when we're living in a sea of estrogens now. Okay, so those are going to be the classic signs of gallbladder issues. Okay, so when you're talking about lemon juice and olive oil, what they would do for a liver flush is you would mix a cup of lemon juice and a cup of olive oil and drink it, and that fat and citrus would hit, and that would contract massive contractions of the gallbladder to get rid of those toxins. The problem is that's dumping those toxins into an intestinal tract. And if you don't have good intestinal motility, you're going to be resorbing those toxins back into the system. So before you do a lemon juice gallbladder flush, you got to do a colonic, a series of them. You got to make sure that your nervous system is healthy, that you got a good, healthy parasympathetic nervous system. And then you can go through, make sure that a qualified doctor, and I mean qualified, not a standard medical doctor, I mean a real doctor like a chiropractor, okay, or a naturopath, somebody that understands the systems. No, and that's true, because the medical doctors, they don't understand what a flush is, what toxins is, otherwise they wouldn't be passing out toxins. I mean, so it's not a slam on them. They're not good for health. For emergency, they're the best in the world. For health, they're horrible. So you got to get to a real doctor, a chiropractor, or a naturopath, and he'll check you out. He'll walk you through that process, and then monitor and see if a good liver flush is appropriate. You don't think I'm going to get comments on that on YouTube? Yes, sir.
If you have an excess of uric acid in your system, other than going vegetarian, to reduce the input of it, How can you reduce what you got already?
Okay, excess of uric acid inside of your system. Aside from going vegetarian, what can you do to reduce the production of it? Usually uric acid is found in joints, and it's called gout. Okay, and this is a defect of a metabolic process called purine metabolism, which is generally found in organ meats, but it's also a defect of the kidneys, the pancreas. It has to do with a defect of how your body processes nutrients. So the only way to solve it, knowing that it's a defect of the filtration system and a defect of what you're taking in your system, it means that your body can't break down those purines. Okay, that's it. So you can't put anything that has purines in your system. The tough part with that is
Everything has purines.
every animal product has purines.
Even rhubarb has purines.
Now, plant-based are going to be a little bit different. The nightshade vegetables, even those have to be decreased. But you can start to decrease the uric acid formation and the uric crystals inside of the joints by getting massive amounts of soluble fiber. So this is where the vegetable juicing comes in. And this is why we recommend spinach, apple, carrot, and celery. I mean, you could vary this. You can put more carrots, you can put less carrots, you can put, garlic, you can put onions, but the reason that combination, the spinach, apple, carrot, and celery, the apples have malic acid to clean the arteries, and it actually breaks up deposits. The celery comes from salary. Okay, salary, people used to be paid in salt. Okay, and celery is super high in minerals. Isn't that something? You didn't know you were going to learn something tonight. Okay, celery is named after salary, which people used to be paid in salt. So celery is super high in minerals. Spinach is super loaded with protein, so that's going to regenerate the tissue. And carrots are loaded with beta-carotene, which turns into vitamin A, which helps the lungs work to get rid of the toxins. Because when you get rid of that uric acid, it's got to go somewhere. Okay, so it's going to go out the lungs, so breathing. It's going to go out the sweat, and it's going to go out the urine. So I don't know of any way to get rid of gout other than going vegetarian. Yes, ma'am.
I was just going to make a comment on that, is that some of what you mentioned, those are usually in the dirty dozen, the ones that have the most pesticides, so it would be wise at least to use organic.
Okay, so the comment was made that most of the plants that I was mentioning are what are called the dirty dozen. I never heard of that. Okay, I like the Lee Marvin movie though. Okay, but the dirty dozen, and there's a number of plants too that you have to buy organic, because if you buy it not organic or commercial, they typically have a tremendous amount of pesticides on it. Pretty much if you're going to eat the skin, it's got to be organic. Yeah, and since we've got access in our area to a tremendous amount of organic farms and farmers markets, it's actually cheap to live off of organic. It really is. I mean, you can raise it. I mean, me and my two boys, a couple $100 a month, and we're eating really good. Yeah, so, and that's all organic.
Yeah, there's a listing, that you can go to. You can Google it.
Yeah,
it'll list what are the...
So since this is being recorded, there's a list on Google you can go to. Okay, that makes it easy, doesn't it?
Right.
Okay, good.
It lists every year which are the most...
Yeah. The best thing to do, dirty dozen, go to Google, list it. If you eat the peel, get it organic. Okay, any other question? Yes, sir.
As you know, I've been coming for a year and a half, and I've eliminated all of the medication that I had been taking that seemed to be causing problems.
That's huge.
However, I was 78 when I first came here, and I'm finding this past month that my left hip seems to be worn out. I'm wondering what to expect from it or to do.
Excellent. Okay, good. Now here's the question. A patient has been with us for about a year and a half, started when you were 78. You were taking how many medications?
Too many.
Too many, that means more than this. Pain medications, everything. Okay, so now he's off all of those. Now his hip is starting to irritate. What's he going to expect? Is his hip going to deteriorate, or can we regenerate the hip?
Regenerate.
We're going to regenerate the hip. This is the beauty of being a human. Okay, you're luckier from this planet. So what happens is, since the hip is starting to hurt, you've got to look at how the hip's going to regenerate. So if you have a sedentary lifestyle, that means that the pelvis is going to be flattened out and the nerves that supply the hip are going to be unstable. Plus, just like the shoulder joint, the hip fits in a socket. And that socket is supposed to hold the joint. Now, if you have one position that you're in more than usual, like a sedentary lifestyle, sitting, or you just happen to be always driving like this or always sitting crooked, that's going to distort the capsule and cause it to be unstable. So a really good exercise to regenerate the hip, and we've had a couple of patients. One gal, she was 83, she had a hip surgery scheduled. She knew we couldn't help the hip. Okay, she just wanted to have her back pain taken away, and she already had the surgery scheduled. So don't worry, she already had the surgery scheduled. Did she have the surgery scheduled? I know, boy, if I heard that once, I heard it 1,000 times. So I said, look, so let's keep the joint as healthy as possible since you're going to have it operated on. No, I'm going to have it removed. I've already got the surgery scheduled. Okay, yeah. So what we did is we put her on a leg weight, had about a 5-pound leg weight, put 2 chairs backwards, and just had her swing her leg, just like this. Now, the problem is she started to swing her leg like this. Okay. Now, am I moving my hip when I'm going like this? No, I move my pelvis. Okay, so we had to train her to have her leg just in that fashion, to just dangle the leg. And she went back as far as she's going forward. So it's just a pendulum. Now, what's this doing to the hip joint? It's opening it up, so you're creating a negative pressure. That's allowing synovial fluid or increased synovial fluid production of the joint. How do we treat it nutritionally? Soluble fibers, vegetable juice, okay, to increase the permeability of the joint membrane. Okay. Now, did we put ice or heat on the joint? Say heat. Heat. Why? Heat? You're crazy. Isn't it going to increase inflammation? Yes, but you put heat on it. Why? Because you want to increase inflammation. So we had her do this, had her do moist heat, had her swing it for about 5 minutes a day. And what that's going to do, that's going to increase joint permeability, increase inflammation, strain the ligaments and discs, and that's going to get it better. Plus, you also have to pay attention to doing that block stretch that we have, which means we got to look more at the calf. So if you're doing the block stretch, fantastic. If you're not doing it, you got to start doing it, because on the calf there's that muscle in there that actually allows blood supply to come back up. And then if the foot isn't healthy, so like let's say, because you can't look at a hip problem as a hip, you got to look at the whole thing. Okay, nutritionally you're doing great. You got rid of the meds. You got healthy nutrients coming in your system. So if your foot is flat, like you're not walking the 20 minutes a day on barefoot grass or sand, that means you're going to start throwing your hips off to the side. And you've seen people walk in the mall like this, okay, where they're throwing their hips. That means that they're walking flat-footed. They're going to have knee problems, hip problems, shoulder problems. When you're walking, you're supposed to glide. It's supposed to be almost like a leopard, okay? I just think they walk cool. Okay, but so it's smooth. You should be gliding. And if you're not, that means that foot problem can translate to a knee problem, translate to a hip problem. So I'd correct the mechanics of everything down below, cause inflammation in the joint above, make sure the nutrients are fine, and will the hip regenerate? Yeah, because your hip's only about 1.5 years old. The only thing you got that's 70, well, 80 now, but I mean the only thing 80 years old now is memories. Your body's brand new. You're a good design. You're made in the image and likeness of who? God. I thought so too. Yes, sir.
I was questioning you're saying that you've never had an open forum. I come here 2 days a week, and you have an open forum every 5 years. You ask the questions and answer them.
Well, the question was, I never had an open forum on YouTube, okay, that I typically ask questions and answer them here, and I guess I do. Yes, sir.
Is gelatin a good nutrient for...
That's interesting. Is gelatin a good nutrient for you? There's because I'm just now studying that, because that's an unusual nutrient. There's a guy I'd recommend, Ray Peat, not repeat, R-A-Y, and his last name is Peat, P-E-A-T, okay? And I'm just now doing research into that. My son, Danny, he would recommend it without a doubt. I would want to look at the source to make sure that it's not from a commercial source where it has antibiotics or estrogens in it. But I'm hearing a lot of good things about gelatin. And gelatin and even certain organ meats, as long as they're organic. But right now, I don't know. Okay, you know, if you ask me again in a month or so, I'm going to ask more. If my son was here, I'd have, he's a, I mean, yeah, I'm an obsessed learner, and that I infected both my kids with it. Yeah, Danny's the expert on that. Yes, ma'am.
Would you, I'm no young kid, so I'm thinking, would you swing your leg just for prevention to keep your hips okay?
The question was asked, would you swing your leg just to prevent any damage? You'd swing every joint. Ideally, you're opening and closing every joint every day. This is why yoga is so beneficial for most. The only problem I have with yoga is it's not specific to the individual. See, in yoga, for every move or extension, there's a counter move or flexion, which is fantastic 5,000 years ago. But if you have a reverse curve, I'm going to tell patients specifically to just do extensions and go back to neutral. Just extensions and go to neutral. But yoga is fantastic. Virtually any exercise program that involves low impact, full range of motion without a lot of stress is going to be excellent to maintain joints for forever. And in fact, when it comes to seniors, I think the oldest yoga instructor in America is 93, and I have a picture of her doing a one-arm handstand. I can't do a one-arm handstand. So joints are supposed to be healthy for forever.
So even walking would be good too, walking?
Even walking would be good. Yep, walking would be considered moving the joints. Absolutely. Yes, sir.
Yeah, my wife has a girlfriend that was trying to lose weight. She went on a meat diet. In fact,
It was on the internet, and it was called the Big Ass Breakfast. And you have to have a pound of meat every day.
Yep. Okay, the question was asked, I'm not going to say your wife had a girlfriend, okay? That could be complicated. No. We are in California. Your wife's friend went on a meat-only diet and lost weight. Yeah, that's actually one of the more popular diets. Okay, it was called the Atkins diet. Now, the problem with it really does. You do lose weight because it's hard to digest the animal proteins. You also go to a system called ketosis where you're checking the ketones coming from your body. It's going to poison yourself, okay, and you're actually going to develop a lot more cancer rates. So it's incredibly deadly, incredibly toxic, incredibly dangerous. But there were people that were going down that pike all along. I don't know how it got by. It's probably the same people that were recommending trans fats and recommending margarine over butter, or you know, the corn and soy oil over lard. You know, it's a lot of stupid stuff that's out there in the nutrition world. But don't do a meat-only diet. I mean, because you can get ketosis and you'll lose weight, but it's not good for your kidneys, it's not good for your liver, it's not good for your body. Plus, it's hard to get healthy animals nowadays. Yeah. Yes, sir.
Comment on lap band.
Oh, a comment on lap band. Anytime you have a foreign object in your system, now there's two things there. One's a lap band, which is safer, and it's done in-house where it's just a band going around the stomach to stop the stomach to swell up so you're forced to eat smaller meals. The other one is a gastric bypass where we're actually going around certain areas of the intestinal tract, stopping absorption. The gastric bypass, you're guaranteed to lose weight immediately. However, knowing that the intestinal tract absorbs certain nutrients along each area, you're guaranteed to be nutrient deficient, and you're generally guaranteed to die earlier from that. But you'll look better. Okay, you'll be a lot thinner, you'll look better. Okay, and what's cool with the gastric bypass is by that rapid weight loss, people get over diabetes really quickly. They get over, a lot of different problems, but they will die earlier because they're nutrient deficient. So I know they look better. Okay, the lap band slowly decreases the amount that the stomach can hold. Now, having any kind of foreign object in your system can typically cause an increased immune system response. So this is where like breast implants, even if they don't burst, can cause an immune system response. This is why certain synthetic or prosthetic joints can cause immune system responses. So it's generally a good idea to not have anything foreign in your system if you can avoid it. What the whole point is for weight loss. Okay, now what people try to do is restrict the calories in order to lose weight. And that's something that doesn't work because your body has a basic metabolic rate. And if you restrict calories, your body adapts to the lower calories. So let's say you go from 2,500 calories down to 2,000 calories. You're going to start to lose a little bit of weight at the initial, but then your body is going to adapt to 2,000 calories. And so then when you go back to eating 2,500 calories, your body has adapted to 2,000 calories, so you're going to put more weight than you lost. Do you see what I mean? So let's say you start off, you're eating 2,500 calories. You drop down to 2,000 calories and you lose 10 pounds. And your body adapts to that 2,000 calories, so you lose 10 pounds, you feel good. Let's say you even eat less. You drop down to 1,500 calories. You're 1,000 calories a day less. Your basic metabolic rate adapts to that low-calorie environment. So when you lose the weight, you start to eat a little bit more. Your basic metabolic rate is adapted to that 1,000 or 1,500 calories. This is why if you go on diets on a consistent basis, you're going to regain the weight more because you're slowing your metabolic processes down each series of diets that you go through. So the ideal is weight regulation. That's where you increase the muscle mass. So it's better to slightly reduce or maybe increase your calorie intake, but increase your workout rate as well. So then that needs to be monitored. But what we found is a lot of people in that fight or flight, that sympathetic dominant pattern, they can't lose weight because the cortisol is being secreted. So anyone in a high-stress environment isn't going to be successful at weight loss. So you got to get them out of that stress first. So if the lap band is supposed to lose weight, find out why there's a problem with weight loss in the first place. It's not because the stomach's holding too much food. It's because either they don't have enough lean body mass to burn up the calories, or their body's adapted to inferior calories, or they don't have enough lean body mass or exercise to adapt to the calorie intake. Does that make sense? Mm-hmm. I know. My kids even asked. They said, "Dad, can't you just say yes or no?"
No fun in that.
I don't, Yes, ma'am.
I'm wondering how important they are. CoQ10 and B12.
Oh, two vitamins she's interested in, CoQ10 and vitamin B12. Both are important. Next? No. CoQ10, coenzyme Q10, is vital. In fact, this is one of the nutrients that cholesterol drugs suck out of your body. This is one of the vitamins that was actually mixed in to the Lipitor formula when they first did the studies on cholesterol-lowering drugs, because those cholesterol-lowering drugs actually suck coenzyme Q10 out of your body, leading to heart attacks. It was considered malpractice there for a while to prescribe cholesterol-lowering drugs in Europe and not prescribe coenzyme Q10. So coenzyme Q10 is vital, particularly if you're taking drugs. It's essential, or you're going to die. Okay. Vitamin B12, very, very important. Okay, and you can get it from vegetable sources. It's also found in a lot of animal products. So healthy animal products, if you can, decrease them, but it's found even in broccoli. It's found in a lot of different plant products as well. But B12 is ideal. But I'd recommend not just B12, because you can't go up in nature to a B12 tree. Okay, you can't go up and get a vitamin C tree. You can't go up and get a vitamin D tree. Everything's in nature is bound to certain flavonoids, phytonutrients, everything. So this is why you need to get nutrients, whole food, in as concentrated a vitamin formula as you can. Brewer's yeast is one of the highest B vitamin concentrates, and it's a whole food format. That's why it's really neat to put a scoop of that in smoothies or anything else. And then that way you get, the B vitamins don't just work by themselves. They also need intrinsic factor from the stomach. They need a lot of stuff working. Yeah, so it's best to get it in whole food sources. Yes, sir.
Ideally, we're vegetarians. Should we be eating fish or not eating?
We're vegetarian. Should we be eating fish or not eating fish? You could live perfectly without ever eating fish. Yeah, and if you are going to choose to eat fish, make sure there's small, non-predatory fish, and now just be careful. Okay. Yeah, because you can't really check them with a radiation meter. It's just a different environment we're living in now. Yes, ma'am.
Lightheadedness when standing up and nausea.
Okay, if you go from sitting to standing and you have lightheadedness and nausea and you're not blonde. Okay, I got three blonde sisters. I had to. Okay, lightheadedness. No. Okay. No. You got to figure that's called positional vertigo. When you I'm going to get in trouble after that one. Okay, when you go from sitting to standing, and this is kind of cool, you could actually check yourself out when you're checking your heart rate. When you go from sitting to standing, you have sensors in your neck that sense that slight decrease in pressure because you go from your legs being bent to your legs straightening, and there's a sudden fraction of a second drop in blood pressure. This is sensed by sensors in your neck called a carotid body and carotid sinus. They check carbon dioxide and blood pressure, and it instantly sends a signal down to the heart to increase heart rate. And that's called positional vertigo. So that's one source. So it could be a neck problem, a sensor problem, a blood problem, or, okay, this goes on another one. So you got sensors in the neck. The second one is you have semicircular canals in the middle ear. And these are really cool. You've got, they look like interconnecting rings, like almost Olympic rings. In the Olympic rings, you've got one like this, and one in an oblique angle. Inside of those semicircular canals is fluid and little tiny hair cells and little rocks. So if your husband upsets you, you can say, you have rocks in your head. He does. So do you. Okay. But what happens is, imagine this. You got a ring. Okay, and if you have rocks in here and little hair cells, if you tilt that ring off to the side, the rocks are going to go follow with gravity and go down. So what that does, when you change your position like this, the rocks actually go down, and I'm lining it up with my eyeballs, and so my eyeballs say that I'm leaning to this side, so right now it's spasming all my muscles on this side to maintain my position in gravity. Now let's say that I had like seasickness, or I had problems with the fluid in my ear, or I had problem with what's called the vestibular ocular system, or my eyeball on the horizon wasn't working. If I'd lean over to the side, okay, I would lose my balance. And that's similar to when I have somebody on my boat, their brain is measuring something, and their eyeballs are measuring something else. Okay, so they have an incongruency with information going into the brain. So what we tell them is, look just on the horizon someplace that isn't moving, you'll be fine. So that positional vertigo, going from sitting to standing, okay, and you feel a little dizzy, could be a dehydration, so the lymph fluid in there isn't working right. It could be a defect of the dorsal columns, which is information coming up from the spine, or it could be a defect in the cerebellum. Okay, so it's neurologic, nutrition, or mechanical. Okay, because there's only three things, and this is kind of cool too. If you've ever seen in the movies, because I know no one here has ever been stopped by the police and asked to do a drug test. Okay, you've probably seen it in the movies. Okay, you need three things. You need two of the three things to maintain balance. You need the vestibular ocular system, which is the eyeball on the horizon. You need dorsal columns, information coming up from the brain through the spine. Okay, and you need the cerebellum back here. Now you can function with any two of those three. So what do the police do? They know that the cerebellum is affected by drugs. What do? They take the eyeballs out, And that's taking out the vestibular-ocular system, so if they know if your cerebellum's messed up, that you're doing drugs, and cool. Then you get those bracelets, and you go up the river for life. Okay. Dramamine, I don't know the mechanism, the clinical pharmacology behind it, but Dramamine is that's absolutely ridiculous. Why is the problem there? You never should take a drug to cover it up. I mean, I've had multiple patients with, and you'll see this, people over 60. A lot of them are having balance issues. Okay, and the reason is, if you're over 60, and do you have a healthy diet generally? You do, okay, but you're a vegetarian. Okay. Say the average person over 60. You're not playing along very well. Okay, the average person over 60 doesn't have a good diet, so their blood's not going to be healthy. Okay, so the heart is going to have to work harder if you're over 60 to pump that thick blood. Yeah, so what are they going to be misdiagnosed with? High blood pressure. So they're going to get a drug that lowers blood pressure. Is that going to help oxygen in the brain or hurt it? So when you go from sitting to standing and that blood pressure decreases, it's going to decrease so much you can fall over and fall. This is why increased falls are associated with blood pressure medications. A couple of good sources on that. And so this is also why finding out why you're dizzy, because if you get somebody that's taking blood pressure medications or cholesterol medications or antidepressant medications or all these medications that can negatively affect balance, you don't want to take a Dramamine. Yeah, I know, that's common. You got to find out. Now, what time is it so far?
About 7 minutes to 8.
10 till? Okay, just one more question. Yes, ma'am.
What about inner ear fluid?
What about fluid inside of the inner ear? Okay, and that causing balance issues. Okay, good. Okay, so we got the semicircular canals. That is the inner ear. Okay, and that's the inner ear fluid. What you're talking about is middle ear fluid. Okay, now this is interesting. Do me a favor, swallow. You hear cracking in your ears?
No.
You should, unless you have swelling of that soft palate. The middle ear, which is where the ear ossicles are, has a constant flow of fluid in there that's always lubricating these ear ossicles. Okay, now that fluid drains through a tube in the back of the throat through the soft palate called the eustachian tube. Now what happens, and this has to do with ear infections. Have you ever heard of ear infections? 93% of the time they're not ear infections, they're ear effusions, which means that the soft palate isn't working right, or the soft palate has swollen up closing off those eustachian tubes. So then that's what happens, like when you get a cold. Have you ever gotten a cold and you feel like you're underwater? And you feel like, you're dizzy and miserable and yucky and everything? That's because the soft palate isn't working correctly, and that could be from an upper cervical thing, or it could be that the soft palate is swollen up from infection, closing off the eustachian tubes. So the fluid that's naturally supposed to fill up and lubricate those ear ossicles and drain is not draining. Now, an ignorant but well-meaning physician will look in the ear and see this red bulging tympanic membrane or eardrum, and they'll say, wow, it must be infected. Okay, it's not infected, okay, at least 93% of the time. So a real doctor will go in there and adjust the top bone in the neck, okay, to free up the nerves that supply the soft palate. They may do a small ear adjustment to loosen up the eustachian tube in there. They may ask you to pour some room temperature water in the ear to cool off the inflammation there. They may tell you to take some hot fluids to increase the inflammation around the eustachian tube to kill any bacterial infection that may be stopping to drain it. And then your ear effusion will go away. An ignorant doctor that's completely foolish will prescribe an antibiotic, which we know, according to the American Journal of Pediatrics and the American Medical Association, they both don't recommend antibiotics for ear infections because it's not effective and it's a sterile environment. So if you've had kids or an adult that's been prescribed that, you need to fire that doctor. You'll get a couple of comments on that one too. But thank you for the first open forum. I hope you liked it.